Hi everyone, this is Margarita. This is
I'm Jennifer Davis.
yes. So I will just definitely say thank you, Jennifer, being flexible. That's our first time to recording the podcast, and then we have a tornado coming. So now we have to reschedule of the whole thing. And then between that time, we have so much story happening in our
Yes,
personal life, right? Yes, yes. I'm just so grateful that you can be able to come in here
Yeah.
today. And then, as all of the people, if you are the listener, you probably will not be see. I do have just received two massage today with great privilege that you being a massage therapist. You through the training, all of that, and you see all of my lines right here. You can see the face cradle. That's from the massage. So don't be scared. And then right here is from the cupping, and which is both are helping so much for the muscle tension. So now with all of the things going on, I am grounded. I'm ready to go. Okay, are you ready?
Yeah.
Yes, yes.
Let's do it.
So yeah. So I am just so amazed how far you went through from your personal journey and everything. So today we are mainly talking about the weight that she carries, right? For all of the lady you are here listening. And then I just want to say you are amazing. You're doing a great job. And so now we have Jennifer here. Jennifer, can you tell us a little bit more? I know that you have a presentation talking about what you're doing and everything. So for some of the listeners that they're not watching the presentation, and then can you tell us a little bit more about you?
Yeah.
Mm-hmm.
So, yeah, my name is Jennifer, and I am a psychiatric mental health nurse practitioner. And so, in my practice, I prescribe medications for mental health as well as do EMDR trauma therapy, and then also offer more of a functional approach to those who want a more natural, holistic approach to mental illness. So that's a little bit about me.
Mm-hmm. You said you will pursue your medical career from Vanderbilt, right? That's
Yes,
Nashville.
yes, yes.
Yes, 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 yes. That's amazing. I used to work in a restaurant and managing over there. It's just right besides of the Vanderbilt. So when you say Vanderbilt, I was like, what?
Oh, really? That's
Yes,
so cool.
yes,
Yeah.
yes, yes. That's amazing for sure, for sure. So, um, before our podcast go through with everything for the audience, I really wanted to kind of like dive into a little bit more about your personal story, that
Hmm.
how you overcome with the postpartum, right, teenager area, and then how do you overcome your own personal journey, overcome for the depression and all of that. So how do you
Yeah.
fight through that?
Yeah.
Mm-hmm.
So I'll just kind of give you a little bit of backstory about me. So before I came into the field of psychiatry, I actually suffered with anxiety chronically throughout my life. And then I had my first daughter, and then I had postpartum depression. It was pretty severe to the point where, I couldn't hold my baby because I was so depressed. I was so worried that something was going to happen to her every day, like constantly anxious. And it really was debilitating for my life. And then I finally was able to go to a psychiatric nurse practitioner who helped me with medication to help me get through that. Postpartum depression generally can last up to a whole year after having a baby.
What?
Yeah,
Oh my
yeah. And
gosh.
so, I had to do medication for that pretty much the whole first year. And then I also pursued some therapy personally to just get through some like past trauma and things. And so I've done a little bit personally of everything that I do. And so, yeah, that kind of just suffering through that made me want to help other people who are also really struggling.
I'm with you. Whenever you experiencing, that's for real. That's
Yeah.
for real, right? Yeah, yeah. So your personal journey help you get through that. I wanted to pursue the psychiatrist. Is that happening before or having after, like
Um,
the post? I know you
so
have a
that,
few babies,
yeah,
so that's
I know
why.
I have a lot of babies.
So I'm making sure. Yeah,
I
yeah, yeah.
have 4 kids, but that was with my oldest. She's 10 now. And
Oh,
so,
okay.
yeah, no, I mean, going through that journey, it really wasn't like a short-term thing to get through, like mental illness, it's not easy. So, I mean, it took a few years to really get to like my full like functioning and potential. And so after that, I pursued regular nursing school. because I thought I would just want to work like inpatient to help people who are in like crisis. And then once I got inpatient and learned more, I was like, I really need to go further so I can be more involved in like the treatment and be able to also do like some therapy as well. So yeah, like my mental illness journey began, maybe like 10 years or more than that even. And then just suffering through that kind of made me want to help others. So, and now
Mm.
I mean, anxiety most of the time never truly goes away. So I even have bad days now where, I have to use the coping skills that I teach my patients every day.
Mm-hmm.
So it's just all about getting back to the best version of you where you can function and it isn't as big of a deal in your life anymore.
Wow, that's amazing. That's
Yeah.
amazing. So, I have some notes right here. I guess I'm prepared in the advantage side. That I'm just asking a question. You just tell me what do you think? Yes, yes, okay. From your experience with working with women, and what are some biggest weights women are carrying today that people may not always see?
Yeah. So I think
Mm-hmm.
women carry a lot of weight that people don't see. I mean, we as women, we often are working, mothers, and we carry a lot of like guilt, I think, a lot of like guilt for not being able to do enough, maybe for our kids, or for like around the house, just things like that. So I feel like women carry this weight because of like the pressure that's kind of put on us. Women are expected to be able to be moms, be able to work, keep the house clean, get kids everywhere. Um, and so just it's a lot of pressure on us. And I think sometimes we can feel overwhelmed, anxious, tired, guilty because we can't do enough, just those kind of things.
Mm-hmm. It was so interesting. Like when I'm driving on the road, right, we were passing the school, you can see when the moms like take the kids to the school bus, they will say, "Hey, bye, honey, I love you so much." You're gonna see that person walking through the aisle until that person sit down, until her son or kids sit down, and then walk out. Vice versa, you're looking at the dash. Oh, okay, bye. Then they just laugh. So I guess like the caring is for real. The ladies
Yeah.
coming from the heart. You
Yeah.
can't hide it, right?
And dads
Yes.
have a lot of pressure too, for sure. But yeah, moms maybe are keeping more things together behind the scenes that people don't see too.
Oh yeah, yeah. Even the single action, taking the kids to the school bus, right?
Yeah,
You're
yeah.
showing that. Yeah,
There's so
yeah,
much more behind it.
yeah, 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 for sure. So, how actually the stress showing up in our body though,
Yeah.
from the when you're working with your patients?
So yeah, mental stress doesn't just affect how we feel mentally and how we act in our behaviors, but it also affects us physically. We were just kind of talking about that in the audience. We really need to kind of help both aspects because whenever we are, overwhelmed, our fight or flight kicks in and it causes things to happen within our body, which can cause like tension, like in our shoulders. It can cause our heart to race really fast. It can cause other muscles to be tense. It can cause us to be tired and just not feel well overall. Um, it can even cause physical symptoms like hair loss and things like that. So it's much more than just our behaviors and our emotions and how we act. It definitely has a physical component.
Wow, hair loss. What?
Yeah,
Oh my gosh.
stress
Okay.
can definitely do that.
I gotta make sure that I'm not
Don't
stressed.
stress, don't stress. Yeah,
The
I
stress.
know, right?
Okay, calm down, calm down. Yes, everything's gonna be fine. I'm with you. I'm with you. So, like when people, I've seen a lot of clients when they come in, right? So, when they are so stressed, and then they are in physical pain, emotionally as well, right? So, and then we can see that that sometimes like maybe just a conversation you asking how their family going, how is everything with them personal life, and then they will feel like triggered, so they feel like okay, something's going on, and then it was showing up and everything. So when I think my question to you is like, I am asking from the audience or even from myself, like whenever you are stressed, you feel that, and then
Mhm.
when your loved one caring for you, they ask you questions, and you feel like I'm being triggered, just like feel
Yeah.
like impatient, you wanting to kind of like express how you feel, and then on the other end your loved one may feel like, I'm just trying to be
Trying
caring,
to help.
asking, I'm trying
Yeah.
to helping you. What do you mean, right? So how the audience, if someone who like you, who like me, feel that way, or someone who at home that experiencing that, how they can be able to navigate, like find out like what triggered to them, or how to notice, oh, I've been triggered or something like
Yeah,
that.
yeah.
Mm-hmm.
So whenever you are triggered, I'll kind of tell you a little bit about what's happening in your body so you can kind of understand that. But basically, there's like this alarm system in our brain, and it's kind of looking for things that are putting ourselves in danger. So it's meant to be able to protect you. So let's say that there was like
Mm.
a bear that crawled in this room right now. My body is going to trigger this alarm system, and then my heart's going to speed up, and like I'm going to be more awake and alert so that I can, run from this bear, get out of the room, or fight it, or whatever I need to do. And sometimes our alarm system just messes up. Because of something that happened in the childhood, like if there was a lot of loud noises or a lot of like physical violence, then a loud noise now that maybe is just a book dropping on the ground can set off this alarm system because your body wants to protect you. So that's kind of like what is happening. But that is a tricky, situation to navigate around because people may be wanting to check on you. And I think it's so important to just be open and honest with your family members if you are feeling triggered. It's okay to just say that,
Mm.
um, but also just being able to calm your nervous system down by getting into an environment that doesn't have that trigger. So just telling your family member, like I'm okay, but I just need like a minute to go and kind of relax. So being able to go into a different room where you don't have that loud noise, and then being able to do some kind of coping technique, which we might learn about in a little bit, but to just calm down your nervous system and kind of tell your alarm system, like, hey, it's going to be okay.
Mm.
Yeah.
I'm super exciting. So,
Hmm.
what are some way people can start managing those reactions in a healthy way?
Yeah.
Mm-hmm.
So in therapy, like if you want to go to therapy, you can learn more coping skills. But I'll kind of teach you like maybe um, a quick one that you could use whenever you are triggered or in that fight or flight. So one thing that we like to teach in EMDR, which is the kind of therapy I do, it's called eye movement desensitization and reprocessing. We teach like coping skills at the beginning so that whenever we're going through like memories and things that happened in the past, the body can be able to deal with that. So one of the coping skills we teach is called a peaceful place.
Mm.
And basically, what you do is go through your mind and kind of find like a good, happy memory um, that it could be like a vacation from when you were younger. It could be like a time at school, your favorite basketball game, or anything really, just that can incite some kind of like peaceful emotion. And what you want to do is you want to write down all of the details about it. You want to write down what made you happy. You want to write down the sounds you heard, the things you saw, the things you smelled, and just really engage all your senses into this. Um, and so that way, what you do, if like let's say a book fell on the ground and my body got triggered, I could just kind of think about all those little details, and my body can kind of go more to this peaceful place in my mind versus this anxious place where I'm at right now. And that will kind of let your nervous system calm down. Because once that nervous system, like the alarm goes off, if we can get it to calm down, then all the adrenaline and everything kind of resettles, in like 15, 20 minutes. So that's really the goal with any of the coping techniques is to just be able to get our nervous system back on track.
Mm.
Yeah.
Wow, that's
So yeah.
amazing. I'm already thinking about it. I was like, oh, where's the next location we want to go? Where's the
Yeah, yeah.
vacation we're gonna go? Yeah, yeah, yeah. And I even before starting on this podcast session, I was trying to asking all of the help, trying to listen and learn. So I find out there is a book called "What Your Bones Tell." tells you. It's
Oh,
like it's a patient like really goes through the whole entire journey, and then they even have a captions that the doctor was really have a session with the client, the recording and everything, how when things went through. I was like, wow,
wow.
people really go through that. I was like, wow, that's amazing to see how much they overcome and everything like that. So from your practice, like what are the most common patients do you see, especially in women's as our main audience today? Like what are the common thing that you see the most?
Okay, yeah. So
Mm-hmm.
in our practice, we really specialize in trauma. And so we do see a lot of people who just growing up had things happen to them that, weren't the greatest. And that impacts their future.
Mm-hmm.
Because whenever we're growing up, like our brain is still developing, and we're kind of learning how to navigate around emotions and how to react to certain things. And so it's such a vital part in their life. And so then if they don't have the best environment growing up, then that can really impact their adulthood. And so basically we're kind of teaching them in their body how to adapt to that and how to regulate emotions in a good way and things like that. So we see a lot of people who have things in their past that they've struggled with, and then just people who women who have like stress and anxiety. Maybe it's because of the overwhelming amount of things they have to do in their life, or maybe it's just like a genetic predisposition to anxiety. But people with anxiety, people that are struggling with depression, and then, of course, like postpartum depression and things like that, we see
Mm-hmm.
a lot of.
You see a lot, right? So like with the anxiety, like I think anxiety pretty much right now everybody has anxiety, right? Like how can they overcome that anxiety when things coming up? Like
Yeah.
it's kind of different, right? When you trigger on getting aggressive is different than the anxiety, right? Always the same category in your.
No, that'd be a little different.
Oh,
But
is it
so
different? Okay.
I mean, there's good types of anxiety and bad types of anxiety, I guess you could
Mm-hmm.
say. And so, like, we need to have a little bit of anxiety in our life. Like, let's say, we are walking down a bridge and somebody dares us to jump off. Like, we need to have some anxiety so that we don't do things that
Jump
aren't
off,
great.
right?
Yeah, yeah. I know that may not have been the best example. We need to have some that keeps us safe. But what we see is whenever the anxiety is kind of like irrational fears, so like worries that a healthy person may die the next day, or worries that like your kid's not going to be safe, and then those irrational fears start to really impact your life, to where like maybe you can't let your kid go to school because you're worried about them, or maybe you can't walk into the grocery store because you're worried something would happen.
Mm,
So that's kind of like the anxiety that, needs more like treatment, is whenever it gets to the point where it's really impacting your life.
mm.
Um, but yeah,
In which way though? Like, what do you mean impact your life? In which way? Is
mm,
that mean that for your definition is bad anxiety is more like a worry caused anxiety? Like, can
more
you?
like anxiety that's stopping you from doing things. Like
Mm,
let's say, um, you work at a school, and you wake up with anxiety every day that something might happen at the school, like
mm,
that you might get in a car wreck on the way to school, and that anxiety keeps you from going to work, or you have to like really, really push yourself hard to go to work. You're anxious, and maybe it's affecting like other relationships in your life. Maybe you're not eating, like things like that. Um, that's kind of the bad type of anxiety,
mm.
that really impacts us, and that's when you kind of need to seek treatment and just learn these coping skills so that it can be a little bit easier on
Okay, that makes sense now
you.
to me. Yeah, I'm starting to register.
Yeah.
I think I feel like I related now, like with everything going on with around the world. Oh my gosh,
Yeah, there's a lot.
anxiety is everywhere. Gas prices going high, then your anxiety going high. How am I gonna pay
Mhm.
all my bills, right? So how are you gonna hold that?
With our coping skills. But I mean, some of the anxieties right now are probably warranted. So
Worth it. Yeah, I'm with you. I'm with you. Sometimes I just like, we need someone talking to Mr. President. Can we just calm down without
yeah,
anxiety?
yeah.
All right. Okay. Hey, if you don't like it, please cut this. Okay. Or just skip this part. Skip
Skip
this
this
part.
part.
Skip this part. We are not talking about politics or anything like
No,
that.
no,
We don't
no.
dislike
That gets us all
anybody.
anxious.
Yeah,
No.
yeah, yeah, yeah. We don't need anxious. Today we're just calm.
Yeah, yeah.
Yeah,
Don't bring up politics.
yeah, yeah. Don't big up politics. Just Mr. President, if you need some help, Jennifer is here. She can help you with. Right? Okay, okay, yeah, 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 okay. So I have a one client was like she has a questions about like with all of the roles, right? They have like school counselors, like therapists, for you psychiatrists, any up to doctors and then everything like
Yeah.
that. So like, can you kind of breaking down a little bit on like for some of us, like we just know like if we have anxiety, we need to see someone,
Hmm.
but who will be the right person to help where we are.
Yeah.
Some people are like, I listened to another book. It's called The Bad Therapies. They were saying, well, no, don't see the therapist if you are in, if you're young or something like that. Obviously, sometimes you need some extra help, right? So,
Yeah.
like, can you breaking down a
Of
little bit?
course. Yeah.
Yes. Mm-hmm.
So yeah, there are a lot of different roles in psychiatry. We'll kind of start with like the therapist. So therapists, they are trained in different modalities, which
Mm-hmm.
is like a different type of therapy. Um, Basically, just to be able to either like reframe negative thoughts, to be able to like process through past trauma, to be able to change behaviors. Like therapy is so vast, there's so many different things, but basically, they're trained in one thing like behaviors or thoughts or trauma. And with talking, or like the modality for EMDR, we do like eye movements, back and forth while they're thinking of like a traumatic memory. But through those things, we help you to be able to either change your behavior or change your thoughts or be triggered less by your trauma. So therapists are kind of honestly like a good first step. Like if you are struggling with anxiety, depression, trauma, any of those things, I think everybody, even if you're just struggling with stress from work, or stress from school, like I think everybody could go to therapy. It'd be amazing. Everybody can benefit from something in therapy. But so they kind of handle it, without medications, without supplements, but just through talking and the techniques that they teach you. So that's kind of like what a therapist does.
Mm-hmm.
Um, if the anxiety and everything is too intense to be handled in therapy, then that's when they may need to look at alternative options. So a lot of people like initially will actually go to their primary care doctor. um, they are trained in mental health medications, so that's kind of like another first step whenever you're just starting to realize that you kind of need some help. But they aren't trained as vastly in the medications as like a psychiatrist or a psychiatric nurse practitioner is. So psychiatrists, they go to medical school and then do like residency within a psychiatric practice. And so they see patients, and evaluate like their symptoms, and create like a plan of care, with medications to be able to help their symptoms. And so nurse practitioners, psychiatric nurse practitioners, do the same thing as them, but we aren't trained as extensive as they are, but we can also prescribe medications. Um, my role is a little bit of kind of a mix of all of it, because at psychiatric wellness, we like to combine the therapy and the medication, because normally, whenever you go to a psychiatrist or a nurse practitioner, you only get like 15 minutes in the room with them. You kind of tell them your symptoms really fast, and then they give you a medicine. But so we want to be able to know people on a deeper level, since we are, prescribing the medicines or using supplements that are, for their mental health. We really want to know on a deeper level what's going on so we can find the therapy portion of it. And it's really unique because, I get to see my patients every week for therapy. But over the span of a month, I get to really know how well their medication is working. So that's kind of the more unique role that I have as a psychiatric nurse practitioner. There's also clinical psychologists, and they are trained to be able to like diagnose someone. So, like, if you're worried that like you have like ADHD, or if you are worried you may be like on the autism spectrum, you can go to them, and they do like a 3 hour evaluation where they ask you different questions. They have you do different tasks, things on the computer, and then they take all of that information and they compile it together to come up with like a diagnosis. And so if you're kind of on the fence about what may be going on, you could go to a psychologist and they could really give you an accurate diagnosis. And then with that diagnosis, you could go to a psychiatrist or a nurse practitioner and they could kind of help you figure out how to treat it.
Okay.
Yeah.
So basically, if people wanting to come to see you, they need to have a referrals from the psychiatrists.
So a lot of people, it depends on your insurance, but sometimes they do require referrals from their primary care doctor. So like the person that you go whenever you just have like a general cold or for your like yearly wellness visit, that may be the first step, is to go to them and let them know what's going on, and then they'll send in a referral to a psychiatric nurse practitioner or a psychiatrist.
Oh, okay. That's very interesting.
Yeah.
Yes. So I know that it seems like in the psychiatry part is very popular now. And one of my clients were even saying that witness is so long to get into, even to
Hmm.
see one of you guys, right? So
Yeah.
how can they overcome that if they feel the needs that they need to see you or they need to see a psychiatrist, but the referral process takes so long to get in there. So how do they
Yeah.
overcome that?
Yeah, that is a big thing. I mean, there's so many people that are struggling right now, and there's not enough providers. So sometimes wait list for an appointment can be 2 months. Even for like psychologists, wait list can be like 6 months out. So it can be pretty hard on the wait. I mean, I think the first thing is if you are in a crisis, like if you're suicidal or feel like you may hurt yourself or somebody else, then you need to seek like immediate help instead of waiting.
Mm.
And there's multiple places in the area that you can go in and kind of get evaluated to see if you need like inpatient help if you were to that point. But let's say that you're struggling with anxiety, or depression or trauma or whatever it is, but you're not in a crisis situation. It's impacting your life. Um, you know, Seeing your primary care doctor can be the first step, because they can kind of get you started with medication if you need it, and so that we can, by the time you get to the nurse practitioner or the psychiatrist, we kind of have an idea of what they did and how well it's working. So that would be a good first step. But also, like, just using things throughout your day to be able to calm your body. So, like, self care can be really helpful,
Mm.
like journaling, just things that can relax you. Like on YouTube, you can get on there and look up, guided meditation. So you can find a lot of resources on YouTube to help just calm your body. You can do like a body scan. So definitely using the internet to find any type of like coping skill and kind of implementing that in their life.
Or can we get a massage?
Yeah, yeah. I know we haven't talked too much about the physical part, but
Yes.
massage, yes, definitely, to help ease that, physical symptom that comes from the mental,
Mhm. Yeah,
struggles.
yeah, for sure.
Definitely.
Yeah, so that's where MAM standing for minds and muscles, right?
Oh, I didn't know that.
Yes,
I
yes,
love
yes.
that.
This is coming after. It's
Yeah,
we reinvented, but that's how it's meaning now. It's
I like it.
minds and the muscles.
I like
So
it.
we can calm your mind and ease your muscle pains. So
Yes, yes.
yeah, yeah, yeah. Yeah, that's amazing. Yeah, thank you so much. So our goal with this podcast is really kind of reminding people that they don't have to carry everything alone, right? So what are some practical way people can begin taking care of themselves when they overwhelmed? I
Yeah.
guess you will mention a lot of things about YouTube, journaling, getting massage. Um, but what if those type of things are not like helping as much while you guys still in a lot of long waiting lists to get in? So is there any other way that they can get in to get some helps, anything like that? Can you give something green lights? Hey, coming to see me. I'm open now. I'm just kidding. I know that's not a normal process, but a lot of people are hoping that way, right? So
Yeah.
yeah,
So I mean, definitely like if you were to try to get like come to our clinic, like our wait list isn't super long. We have quite a few providers and we're trying to expand across Oklahoma to help fill the need. But if
mm-hmm.
you are struggling and things at home are not like working well, I mean just express that to the clinic as well. So that they know the severity of your condition and maybe they can kind of squeeze you in. Tell them, that you can come in if there's like a cancellation, so that if they have somebody cancel last minute, they can call you and put you in. Um, but also, just don't forget that you do have people around you, that can just help support you. If you need to talk about things and what you're going through, don't hold it all in. Um,
Mm,
talk to like your friends and family and make sure that, you're not going through this alone.
mm. So why is it so important that you're not feeling going with along?
Well, yeah.
Mm-hmm.
Well, I mean, depression and anxiety itself can feel really isolating.
Mm,
Sometimes when you're feeling anxious, you feel like you're the only one in the world that's suffering to this intensity because it's really, really hard. And, you see everybody else like living their lives on the internet that looks perfect and like nobody else is struggling and you feel like you're, alone in it. So, um, depression and anxiety by itself is so isolating. So I think it's important to be able to reach out so that people can know when you're struggling. They can know if you're needing more help and they can help you get there because it takes a lot of courage and bravery to reach out and get help. So having somebody to walk alongside you through that can be really helpful so that you don't have to go get help alone by yourself.
that's amazing. I feel like this is great advice for some of us, like even like all of people are ladies or um, our podcast is the healthy go-getters, right? Everybody's taking care of everyone else by themselves, right? So then you feel like you're alone. So it's very important find a person who you can talk into and
Yeah.
then have someone along with sign with you. And then if you need some help, definitely come to see Jennifer, just open some green lights if someone who needs it, okay? Especially the audience who are coming
Yeah.
from the healthy go-getters, right?
Yes.
So yeah, give some green lights to see them. How is that? Yes, yes, yes.
Definitely.
And thank you so much for your time to come in to really tell us how can we helping us go through when we having the depression, anxiety, how to overcoming the find the providers, how to help, and then everything like that's really really helpful. Yes.
Thank you. Yeah,
Mhm.
thank you so much for having me.
Yes, yes, yes. Do you have anything else that you want to let our audience know and then everything?
I mean, that's the main thing is just like, you don't have to go through this alone.
Mm-hmm.
There are people out here like me who have been through this before and want to help you to be able to get your life back and get back to, the happier version of you. Um, so just don't be afraid to seek help, whether it be a therapist or a psychiatrist or nurse practitioner. We're really just truly all on, hopefully, on your side and just wanting to help see you be the best version of you. So don't be afraid to reach out. And know that when you do, like, be proud of yourself. Like, it takes a lot of courage and bravery to be able to talk to somebody about some of the things that have happened in your life. And so, just, once you do reach out, you got to give yourself a little pat on the back too for doing that because it's hard.
You're amazing. Just remember
Yeah,
that,
exactly,
right?
exactly.
Yes, 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 yes. So now, how people can find you then? Even though we have you on our resource page, you can see all of the tips and the tricks that she sharing to helping to overcome the anxiety, helping with sleeping and everything like that. We have the whole thing about her, and so you can definitely looking at our resource page. But however, can you tell us a little bit how people can find you if they are
Yeah, for
listening right now?
sure.
Yes.
So we have quite a few different locations in Oklahoma. So if you're listening out from rural Oklahoma, we may be able to help you out there too. All of our locations, we have one in Thomas, Oklahoma. We have one in Elk City, Yukon, Del City, and Oklahoma City. So we also do virtual appointments. So first, if you are interested in seeing us at Psychiatric Wellness, you can go on our website, and there is a new patient intake form. Or you can find on our website our phone number, and then Kylie, our intake coordinator, is who you would talk to. You can even text our phone number and just let them know, like, hey, I'm interested in seeing someone here. And then Kylie will text or call you and help figure out which is the best clinic and which is the best provider for you um, to see. One thing about us is we have a really long, extensive intake form because we like to get to know everything. Well, not everything, but a lot of things about you before you even walk through the door. Our providers all spend like at least an hour or an hour and a half reading over intake paperwork and creating a customized plan before you even walk in the door so that we really have a thorough idea of what's going on and we aren't just like kind of guessing and just throwing medication at you. So may take you a couple hours, or you may have to take multiple times to fill out the intake form. Just don't get discouraged. It's totally worth it. And we look at it and everything. But so, yeah, just reach out to us on our website or text Kylie. And then you can also view our providers on there as well and kind of see everybody's picture and a little bit about their story so you can see who might be the best fit for you.
Wow, that's
Yeah.
amazing. Yes, 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 that's awesome. And thank you so much for your time today
Yeah, thank
for the
you.
listeners. And definitely, if you are listening, subscribing our YouTube channel and also our Spotify and the Apples as well. And then we are really appreciate your time to listen to us today. And hopefully you find this helpful. And then if you need help, definitely see Jennifer, right? Yes, or her clinic, right? So you have all of the
Yeah.
providers. Yes,
Or
yes.
come get a massage
Yeah,
too.
come
Yeah.
get a massage too. Yes, we're
Both. Do
here for
both.
you. Do both. Yeah, yeah, yeah. We're here for you. Yes. Thank you guys.